Hello, we are Carbon Musso, Amatul Fulani, and Laura Panak from Longwood University's Department of Communication Sciences and Disorders. This semester, we participated in a research study titled The Effect of Teletherapy on the Treatment of Social Skills in Children with Intellectual Disabilities, Perspectives of Professionals in the Field of Speech-Language Pathology. For this study, we surveyed SLPs in Virginia and asked them about their experience with teletherapy in children with autism spectrum disorder and intellectual disabilities. Autism spectrum disorder is a neurodevelopmental disability characterized specifically by social deficits, and which is things like joint attention, eye contact and conversation skills. With the advent of the COVID-19 pandemic, teletherapy has become inevitable with all of the shutdowns of schools and businesses across the country. Since this happened, teletherapy was necessary in order to teach skills of all ability levels from the school system. It's difficult to teach pragmatics across a computer screen, seeing as it involves social interaction with humans, typically face-to-face, people talking to each other and interacting with each other. It involves things like catching on to subtle cues, maintaining topics, maintaining eye contact, keeping an appropriate distance from someone when talking to them, and transitioning topics when having a conversation, and talking about things that the other person wants to talk about, not always what you want to talk about, which is sometimes difficult for children with ASD. So we wanted to learn about how easily this was implemented over teletherapy, and what strategies are being used, and what things can be done to help improve it in the future.
So we sent out a survey through social media accounts, personal connections, and word of mouth. Our inclusion criteria included certified school-based speech-language pathologists, speech-language pathologist assistants, and clinical fellows in Virginia that were working on pragmatic skills with children with ASD and/or ID through teletherapy. The survey was 25 questions that included multiple choice, short answer, and questions using a 5-point Likert scale. We had 9 SLPs, 2 SLPAs, and 5 CFs complete our survey. The counties in Virginia that our participants served included Danville, Culpeper, Spotsylvania, Chesterfield, King William, Greene, Henrico, and Fairfax. For our quantitative results, we looked at the average of 6 questions to see if our participants agreed that teletherapy is an effective model of delivering services. We used a Likert scale ranging from 1 to 5, 1 being strongly agree and 5 being strongly disagree, to compare our quantitative data. And you can see that in the chart at the bottom, and we have the 6 questions and their types: effective techniques, comparable to in-person, overall progress, student engagement, parent involvement in the session, and parent engaged overall. And on the other side is the mean or the average, 1 being strongly agree and 5 being strongly disagree. So you can see that most of our respondents said that they either agree or neither agreed nor disagreed. We also analyzed themes in our short answer responses, and we broke those up into 3 different themes: positive response to technology, parent engagement is directly related to effectiveness, and barriers are still present. We used direct quotes from our responses to show how the professionals felt teletherapy was working. On average, most respondents agreed that teletherapy is an effective model of service, and students were making progress in social skills. Our respondents agreed that parents and students were actively engaged through each teletherapy session. We did note some limitations in our study. Teletherapy is a relatively new format in Virginia due to COVID-19 pandemic, so they may not have had as many resources or access to training or knowledge about teletherapy as a whole. We also had a low number of responses due to our inclusion criteria being very specific, and we only surveyed professionals in Virginia, which resulted in fewer responses.
So in future research regarding this topic, we could expand our inclusion criteria so that we could have a larger base of our survey respondents and survey possibly SLPs, SLPAs, and clinical fellows across the country, not just in Virginia. And then we could also focus more on learning about the specific strategies that are used to teach pragmatic skills to students with ASD or ID, especially across a computer screen using teletherapy, to learn more about what they're doing, what's working, and what's not working. At the bottom of our page, on the bottom right corner, there's a QR code that can be scanned to see the specific, all of the questions in our survey if you're interested in that. And we have also a QR code linked to all of the resources that we used and referenced in all of our research, in all of our papers and studies. Thank you so much for listening.